Hello, y'all. Welcome to Questions and Answers. Let's get to it. So this is a 15-minute live Q&A with your CEO 3 times, the real Alisa Applewhite. I am the real Alisa Applewhite, y'all. And why do I go live Monday through Friday? It's simple because you keep asking me questions. So keep asking me questions. Keep DMing me, emailing me, texting me, messaging me. Y'all, I'm late today. I'm normally here at 12 o'clock, but I had to be with my students. Like I deliver every time. I could not leave them in the middle of learning. So I apologize in advance, but I'm here. I'm showed up. All right. So email me, text me, call me. Right? Don't call me because I ain't gonna answer the phone. Email me, text message me, DM me. The questions that you have. So this is why I go live so I can answer your questions, y'all. And today we have a really, really good question. So I'm super excited about this. We're live here 12 o'clock p.m. On all platforms except for TikTok and LinkedIn. You can literally, and we're answering the questions live. If there's a recording, we'll let you know on Fridays, Saturdays and Sundays, y'all. There is a recording. So you have a recording on Saturdays and Sundays where we record the questions that you ask. So keep asking us questions, y'all. I promise you we answer them and we give them 3 things on how to solve the question or give you the answers to the question. And I love it because you make me do research. All right. So the question for today is, this is episode number 142, meaning I have been going live for 142 days. What is maximum healthcare staffing? Okay. So somebody had asked, what is maximum healthcare staffing? Y'all, I am a staffing agency, but I feel like I don't have any competition. So I don't mind answering stuff when it comes to other staffing agencies. So thank you for asking this question. Okay. So what is maximum healthcare staffing? Boom. First answer. Maximum healthcare staffing is a healthcare staffing agency. Oh, I got to put the clock on. Wait a minute. I got to put the clock on or I keep going. Let's see. Boom. It's a healthcare staffing agency. What is a healthcare staffing agency? It is an agency that staffs medical professionals in hospitals, nursing homes, doctors' offices, government facilities. Let's see. What else? Group homes. Sometimes they have their own nursing homes, assisted living facilities, long-term care facilities. What is it? LTACs, long-term acute care facilities, home health. Sometimes staffing agencies have their own home health, right? And one of the things about maximum healthcare staffing is they do have their own home health section, right? So maximum healthcare staffing has been around for a very, very long time. They are one of the big pushers in healthcare staffing. They are not in the top 10. Okay, so they're not in the top 10. I had to look at my notes to make sure I was lying about that, but Maximum Health is not in the top 10 healthcare staffing agencies, but they're huge, right? All right, so what is Maximum Healthcare Staffing? There are a healthcare staffing company. They staff medical professionals in medical facilities, okay? Now, what is Maximum Healthcare Staffing, y'all? They've been open since 1988. All right. What that tells me, y'all know I'm very honest about my age. I'm 39 right now. I'll be 40 next year. In 1985, I was born. So Maximum has been open since I was 3. Okay. I don't think they were prepared for this little chocolate girl to come and try to shake up the industry. But she here, right? So at 3 years old, when they was opening up, when I was 3 years old, when they was opening up, y'all, literally they have been running since 1988. So if I'm 39 minus 3, they've been open for 36 years. Okay. One thing that tells me about that company is whoever started the vision, they were very, very adamant that this vision was not going to die, regardless of them or their family, whoever started the vision, right? They were very adamant that this was going to stay open and this was going to be a legacy and passed down to their kids. All right. So kudos to you, Maximum Healthcare Staffing, for being in the industry for 36 years, y'all. 36 years. So with that being said, can you imagine having a housekeeper or somebody taking care of you for 36 years? You're going to believe year after year that they're going to show up regardless of what. Why? Because they have dedicated 36 years to you. And this is why I tell my brand new staffing agency owners is you are not in this just for today. You're in this for the life of the business. There's only two reasons why you should have a healthcare staffing agency. That's number one, to build it up to pass it to your family or your kids or to the government, or to sell it. That's it. It's only two reasons to have a healthcare staffing agency. If somebody else know a different reason, please let me know. But in my mind, there's two reasons to have one. To build it up so it can be a legacy, like Maximum Healthcare Staffing Agency. They're going to be a legacy. If they close down tomorrow, they've been open for 36 years. They're going to always be talked about. Do you understand? They have dedicated medical professionals to the healthcare industry for 36 years. All right. Times that per month, times that per days. They are that dedicated. So shout out to Maximum Healthcare Staffing. They got the right help because they are around. Okay. You got a lot of agencies that started during COVID and they just closed their doors. Why? Right? What was your purpose? What was your goal? We are in this through the highs, through the lows, through the, oh my God, I just want to quit. I just want to sell it. We are in this. I know what our mission is for top of the line healthcare staffing. The question is, do you know what your mission is for your business? Whatever business it is, right? What is your mission? Are you going to keep it to pass it along, or are you going to sell it? Okay. You decide. Either way, if you're going to sell it or you're going to keep it to pass it along, you have to build it up. You have to. You cannot give somebody and nobody's going to buy something that's not built up. All right. So they have literally been open since 1988. So for 36 years, they've been open. They literally staff, I believe, 32. Let me see. I'm in the background here because I had to pull up some notes. They have offices in 32 different states and offer services throughout the country, y'all. They literally specialize in putting medical professionals, including nurses and stuff, but literally 1988 they have been open. It's crazy, right? And the crazy part about it is, excuse me, now that I'm a staffing owner, I used to work for Maximum as a home health nurse. So I used to work for Maximum as a home health nurse. Now, did they pay me what I wanted? They paid me what I needed at the time. And that's the only thing I'm going to say, right? They paid me what I needed at the time, and I had no issues with them. It was just that I couldn't do home health. It was too much weight for my body, and my emotions was too emotional. I needed somebody to be there to advocate at that moment for the patient, and I didn't have access to people. So I realized home health wasn't for me. That hospitals and nursing homes are for me because I can actually get the help people need right away. All right. So they've been open since 1988. Let's go back. Is my timer still on the clock? Yep, we got 9 minutes. All right. Now, I'm going to read y'all all this thing because I looked it up. What is Maximum Healthcare Staffing, y'all? It is many different medical professionals, okay? And when I put that many different medical professionals, I was going to put in there literally all the medical professionals. I said, nope, I'm not going to do that. I'm just going to read to y'all what the many different medical professionals are, all right? So Maximum Staffing has connected the nation's top talent to the variety of healthcare providers. We specialize in creating meaningful career opportunities for medical professionals, including, okay, these are the professions that they staff. They staff nurses, which makes so much sense since nurses are 86% of the industry, of the whole healthcare industry. Makes so much sense, okay? LI health professionals, y'all, we talked about LI health yesterday, so I love it. Locum tenens. All right. So for those people who like, Alisa, what is locum tenens, y'all? Locum tenens is a fancy word for doctors. Okay. We specialize heart doctors. We specialize primary care doctors. We specialize GI doctors. We specialize on cardiac cath doctors. We specialize on endo doctors. We specialize on diabetes doctors. We specialize on surgical doctors, right? So locum tenens is a fancy word for we specialize on doctors, right? And that's also, I believe it falls in the place of nurse practitioners. I'm not sure. I know it was 100% for medical doctors when we said, hey, so we do have a local tenens plan. I'm just saying that. I'm putting that out in the universe. Well, I'm putting it God already know. So I'm putting it out in the world. We do have a plan to do locum tenens as we grow. But that is just a fancy word for doctors. That's it. All right. So they do travel nurses. They do medical coders. I didn't even know that. I knew that you could staff medical coders, but I didn't know they did medical coders. So I'm learning that today. All right. So Alisa, what is medical coders? Exactly that. When you have insurance, right? You literally have to code the insurance a certain type of way. So the hospital can get reimbursed for that particular charge. So prime example, right? If you have a patient with a wound, based on how you code the wound to bill to the insurance people, it has to be coded right, right? Is this a wound that was the person came in the hospital with and you're treating it as a hospital? Or is this a wound that the person had since they've been under your care, right? So we know in the healthcare industry that if you came in the hospital with a wound, I can now bill the government. I can now bill the insurance people for all of the gauzes that I used, the time my nurses took, the documentation that they had to do, everything that had to do with charging that for that, taking care of that wound, I can bill the insurance for. Now, if the person is in the hospital and they get the wound while they're in the hospital, I now cannot bill the hospital, bill the insurance for that, right? Now there might be some stuff that I think they eat the whole 100% cost. I really think they eat the whole 100% cost because they're really sticklers for we can't have bed wounds, we can't have falls again because they have to pay this 100% cost. So the I'm going to stick with that. That's my final answer. So if the person gets a wound while they're in the hospital has to pay for all the materials. They have to pay for the staff. They have to pay for the healing of the wound. They have to pay for all of that. Okay. The insurance will not cover things that they consider is preventable. So that's what medical coders do. They look at it and say, hey, what is a code that I can legally use so we can get this insurance company to reimburse us back for the work that we did in this medical facility. All right. And much, much more, right? They literally Maximum Healthcare Staffing, y'all. They have workforce management services. I believe they have a software. They got a SaaS, y'all. They got a SaaS. That is huge. That's huge. I'm gonna leave that alone. All right. And they're focused on hospitals, schools, government programs, correction facilities, y'all. So when I hear that a healthcare staffing agency staffs correctional facilities, that lets me know that they have government contracts. You can look this up for free to see how much money they was rewarded. So I love it, right? So correction facilities, and they are managed care organizations, so MCOs. I don't know which managed care organizations. I know what an MSP is, but I don't know what an MCO is. So again, I'm learning with y'all. So Maximum Healthcare Staffing, y'all, they staff different type of medical professionals. We learned today that they do medical coders. We learned today that they be staffing in these government hospitals. So that lets me know that they might be a potential MSP or vendor management system, VMS, which lets me know as a small agency. And for you small agencies out there, I'm not a small agency, I'm a boutique. That's what I say, I'm special. All right. So to let me know, to let the world know, hey, they might do it where they do subcontracting to you. Right. So reach out to Maximum Healthcare Staff and see if they do subcontracting to see if you can partner with them and help them fill some of the needs that they can't fill. And you get paid, they get paid, nurses get paid, and the medical and the patients get the help that they need. At the end of the day, the patients get the help they need. All right. So we're going to go over this again. What is Maximum Healthcare Staffing? Number one, y'all, it's a healthcare staffing agency. Healthcare staffing company. We talked about that. They've been open since 1988, 36 years. Kudos to you, Maximum. And then we have many different medical professionals. All right. So why do they call me CEO 3 times, y'all? Is because literally, everybody do 3 times something in their life. I'm bossing myself, I'm bossing my children, and I'm bossing my community or my job, wherever I'm at, right? Well, businesses, these 3 businesses. So everybody's CEO 3 times. So you're bossing it. But why do they call me CEO 3 times, y'all? Because we have 3 companies. One of the companies called Top of the Line Healthcare Staffing, where we staff medical professionals in hospitals, doctors' offices, and nursing homes. All right. So the next one is TOTLHS Hard to Go Inc. This is our nonprofit. This is the baby that takes care of our baby. Then we have the real Alisa Applewhite Consulting. This is our consulting company that literally helps us bring this to you every day for 15 minutes, right? Free of charge to you. You don't get paid. You don't pay anything for this. So please send us your questions. We're going to answer them live. We're going to give you 3 points so we can answer it for you. It does not have to be healthcare staffing questions, y'all. I answer some crazy questions. Like I remember one time I did an episode. Y'all need to check it out. Why can't I be your friend? Some men be DMing me and they be like, why can't I just be your friend? And I answered it live. Like, this is why you can't be my friend. Okay. So check that video out. That was a fun video for me because I got a chance to just naturally be myself, which I'm always myself. Nobody's going to change that at all. All right. So the real Alisa Applewhite Consulting, we help everyday people build healthcare staffing agencies from scratch. So this is what we're doing just now. And literally, we doing workshops. So tomorrow's our workshop. Y'all do not miss it. It's not too late to get your tickets, right? This ticket's only $4.97. Get your tickets because tomorrow we going in when it comes to you literally being able to get the clients that you need to help your business in whatever industry you're in, right? This is not an industry-based workshop. This is if you are a business owner or a future business owner and you want to get to the bag right away, you want to actually do the work, jump on this call. All right. So go ahead, register. We're going to show you that link. Y'all, we help everyday people. We help everyday medical professionals elevate their experience. If you're like a med-surg nurse, you want some ICU experience, boom, we can help you. All right, so follow me on all social media platforms, y'all. The Real Alisa Applewhite Consulting. Again, that is The Real Alisa Applewhite Consulting. Again, that is The Real Alisa Applewhite Consulting, y'all. Tomorrow, we have the workshop. Go to the workshop, www.therealaac.com workshop, where we are literally helping you get to the client directly. We ain't got time for fluff. We ain't got time to be bringing up no slides. We are doing the work, and this is from 9 in the morning till 1 o'clock in the afternoon, okay? Depending on the package that you pay, but prices start at $4.97. So let's go. All right. So this is the Make the Call to Get the Client workshop, y'all. We are still deciding if we want to do it every week. We are still deciding, but get into this tomorrow. Do not miss this. Get your tickets today because I don't know if I want to do it next week. I'm just being honest. Look, that's the great thing about choice. You're like, I don't know if I want to do this next week. All right. But I absolutely love y'all. As always, y'all, I just want to say, go build a relationship with your creator. God is amazing in every way. Go out and build a relationship with your creator because God loves me more than my kids, my husband, any of the friends that I have, my parents. And the reason why I say this is because God is the only one who could say to me, have life, breathe, and I get to breathe another day. I have worked as a nurse for over 20 years now as a medical professional. And I have seen so many people cry and beg for God to give them a second chance with their loved ones. And I've never, not one time have I seen the body wake up and say, hey, here's your second chance. Love me again. Okay. So this is how I know that God loves me so much more than anybody, because God allows me to breathe so I can talk to you and be with you. I'm so glad you're here today. If nobody told you they love you today, I love you. I love you. I don't even know who you are, but I absolutely love you. All right. So go out, build a relationship with your creator. Let's hit it from here. Where are we going? I think we did that yesterday. Let's do this today. I will see you tomorrow. Time is not promised to anybody. So you have to be very intentful with your time. Because the simple fact of when you are in business, you are given so many tasks, you're given so many things to do that if you don't have a specified time on when you're going to do these things, when you're going to target these things, then they get lost in the sauce, right? And you should always do your intent schedule based on what has to be done now. What needs to be done right now that's going to generate revenue for my company or my business,
right? How to get to the, as David Shan says, how to get to the bag now, right? So that task is always within that 1 hour block, where you break it down to 15-minute circles, or you can break it down to 30 minutes, however intense you want to be. Intense for me is 15 minutes. I want to know what I can accomplish in 15 minutes. And when we get a little bit more intense and see, I want to know what I can accomplish in 5 minutes, right? But right now, see what you can accomplish, because the thing that is going to get you to the bag first or get you increased revenue is the thing that's going to keep your business going. So you have to prioritize, right?